Good morning, everyone, and thank you for attending our seventh installment of the Business Recovery and Sustainability webinar series through the St. Louis Regional Chamber. This webinar is focused on the intersection of healthcare and technology. My name is Tabitha Saris, and I am the Vice President of Investor Relations at the St. Louis Regional Chamber. My co-moderator and the person behind the magic of the webinar is Bethany Monahan, our Director of Business Engagement at the Chamber. A few housekeeping items. Everyone is automatically muted. We encourage you to ask questions throughout the webinar. Please submit them via chat, and Bethany will read those throughout the webinar if necessary, or at the end for our panelists to answer. You will receive a copy of this presentation after the webinar is complete, as well as with any links or information that our guest speakers have alluded to. Before we get started, I want to give two big shout outs to our amazing sponsors, Technology Partners and Kitty Academy, who is serving St. Louis healthcare and essential businesses in this time of crisis. We appreciate you. So let's get started and meet our amazing panelists. Our first up is Guy. Guy, would you like to go and introduce yourself?
Sure. Hi, everyone. I'm Guy. I hope everyone's doing great. I know it's been a few months of working from home, so I hope everyone's coping well. I'm the CEO of SteadyMD. We're a local company based in the Central West End. We're a technology platform. We're best known for our, being one of the only players that practices online concierge primary care. So you can get a concierge doctor completely online on our platform. There's a lot more to it, but I'll stay brief. So that's the basically what I do and who I am.
Fantastic. Next up is Blake. Welcome, Blake.
Thank you so much. Thanks to everyone for taking the time and for your hard work during COVID. I'm Blake. I'm the CEO and founder of CareSignal, a healthcare technology company that focuses on serving patients with chronic conditions, and specifically the patient populations that are potentially more sensitive and, if not properly managed, more expensive. CareSignal has now more than 10 peer-reviewed journal publications showing that our technology actually drives clinical and financial outcomes. And we have the privilege of serving a couple dozen providers and payer organizations, both in St. Louis and then nationally across the country.
Thank you for joining us. And now we have Dr. Alan Freeman.
Hi, everyone. I'm Alan, and President and CEO of Affinia Healthcare. Affinia Healthcare is one of 29 community health centers in Missouri and 4 in the city of St. Louis proper. We are an essential provider of health services during this pandemic, this crisis, and have seen a fair amount of change and very rapid and fluid development. So on behalf of our patients and our staff, I'm really pleased to participate today. Appreciate the invitation, and I hope to share some of our observations and how it's affecting our patients and our organization. So thanks.
Well, we appreciate you. And oh my goodness, I'm so sorry. And finally, we have Patti Fischer.
Okay, thanks, Tabitha. Hi, I'm Patti Fischer, President and CEO of St. Elizabeth's Hospital, HSHS, in O'Fallon, Illinois, the other side of the river. And I've been here for 2 years, and I've been with HSHS for about 6 years now. My background is in nursing, and I tend to refer to myself as an old ICU nurse. Now, my friends will say that referring to myself as an old anything isn't very flattering, but you know, it is what it is. So any of you who might know ICU nurses, you know we love to be in the midst of chaos, always fighting fires. So I'd like to say that, you know, I was made for a crisis, but truth be told, I am ready to get back to some sort of normalcy, whatever that may be. And I'm very honored to be asked to participate today, and I'm looking forward to the discussion, and like to thank the Chamber and Tabitha and Bethany for inviting me. Thank you.
We appreciate you, Patti, as well as all of our panelists. So thank you for spending your morning on our webinar sponsored by Technology Partners and Kitty Academy. Please remember to submit your questions via the chat and we will answer them throughout the presentation or at the end of the conversation. So today we're going to talk about the common thread or the intersection that we have between healthcare and technology, which is the people and the experiences that they are having right now. So the impact, we can all physically see how COVID is impacting the health industry. You can turn on any news station and see how it changes day to day. But if we dig a little deeper and we want to know how it's impacting services, patients, and our frontline workers. So I'm going to turn to Patti and Alan first. We'll let Patti start and then move to Alan. How has COVID impacted the services offered at your healthcare facility?
Well, COVID has drastically impacted our services and our patients at our facility and all hospitals almost universally across the country. When things really started to heat up, we across the country stopped doing elective procedures and many diagnostic testing. And we did this in anticipation of a surge and making sure that we had the capacity in our hospitals to care for patients who would become positive. So thankfully, most hospitals, especially in our region, did not reach that surge capacity and were able to carefully care for the patients who presented to our hospitals. Unfortunately, the unintended implication is that many patients quit coming to the hospitals and quit availing themselves of healthcare services. And most hospitals saw anywhere from a 40 to 50% decrease in volume and revenue. And we did such a good job of telling patients to stay home and stay safe that they did. But unfortunately, sick patients stayed home. And so what we saw were people having strokes and heart attacks in their homes. And those who did come to the hospital in the emergency room were much sicker than we were typically used to seeing. In fact, I rounded in the emergency room yesterday and we had a patient who was there who was extremely sick because he had stopped going to dialysis. He was afraid of getting COVID at the dialysis center. And for those of you who know, dialysis usually is done 3 times a week. And this poor man was extremely sick and much sicker than, like I said, we're used to seeing. So what we're doing is trying to get information out to the public on social media and other platforms that it is safe to come to the hospital and that we can carefully and safely care for patients, and to make sure when you are sick that you come early so that you can hopefully forego these devastating circumstances that people get themselves into when they are sick. In addition, we're also ramping up elective procedures so that we can start caring for patients as we had done pre-COVID, and making sure that we do that carefully and safely, but we're confident that we can do that. So a little bit about what we're doing now.
Wow, that's amazing. Alan, let's turn to you. What has been your experience with Affinia during this time?
First, Patti's was a great report, very helpful. Our organization is an ambulatory services organization. So we don't have beds, we don't have ICUs or an emergency department. It's a medical, dental, behavioral health, a wide range of enabling services. We serve about 44,000 unique patients a year in our region. 90% of these patients have household incomes under 100% of the federal poverty level, and about 40% are uninsured. So it's a vulnerable population of low-income individuals, and our organization has a mission to serve them directly. Since about March the 16th, our volume of activity has dipped 65% below what we projected. Telemedicine, telehealth has been an important force for us during this period. We've noticed that regulations have relaxed a bit. Reimbursement opportunities have improved a bit as a result of the COVID pandemic and the crisis, the emergency. And so we've been able to use those opportunities to connect more directly with our patients while they are at home and to serve them. It's less effective for dental services, of course, but for medical and behavioral health, about 49% of all patients that we've seen since March the 16th have been individuals served by telehealth. Again, we're only at 35% of our budgeted expectation, so it's been a dramatic impact. We are also an organization that is providing testing services in the broader region. And Tabitha, I'm unsure if you would like for me to talk about that now and give a summary or an overview, or move that later in the agenda. I'm pleased to talk about it at any time.
I would say, let's jump in and talk about it. Affinia has been all over the news for the amazing work that you're doing for your testing stations.
Well, for one thing, we have staff who are available, who we chose not to furlough, and their services could be shifted in an outreach manner for this public health activity. We have 5 drive-through stations and a number of mobile locations that have served St. Louis City and St. Louis County since April the 2nd. As of yesterday evening, 2,764 people were tested. The COVID positivity rate has been about 10% there. So 1 in 10 of those patients has tested positive. About 17% of that activity has occurred in our mobile stations, so at long-term care facilities, at community locations, churches, working in concert with state representatives and other public officials. So we've been out there testing people for COVID and helping to refer them for subsequent services when those are needed. One last fact there, about 66% of that total number of 2,764 have been African American, and about 18% Caucasian, and about 5% Latino. That's fairly relative, I should say, to our population served and also to our employee base. So we tend to be serving the proportion of the population that is representative of our patients we serve and also our employees.
Lots of great information. So you dropped a nugget that said, and I could be wrong, but 49% of your patients use telehealth at this time. So I want to transition to Blake and Guy because this is their wheelhouse. So Blake and Guy, and we'll let Blake go first. How has COVID changed the landscape of telemedicine?
Yeah, I think that Patti and Alan really touched on a lot of the material examples and then how those changes are manifesting. At a high level, we're seeing a change in both the conditions, of course, under which care must be delivered, both preventative and reactive care. And we're also seeing a pretty robust shift in the incentive structures, and I think that's largely for the positive. From the conditions perspective, every patient, or at least most patients, especially those with chronic conditions, have functionally begun to experience what life is like for rural populations. It doesn't matter if you're 2 miles or 200 miles away from a physician. To Patti's story, if you're afraid that you might be infected and you know that you're a high-risk population, that can dramatically shift your behavior, potentially for the negative. On the incentives side, we're seeing new fee-for-service codes released, and we're seeing a lot of the codes for telehealth and comparable remote patient monitoring solutions become more relaxed. Now it's acceptable to support a patient via good old-fashioned phone call, which is really encouraging. Materially, CareSignal has seen the average age of the patient population and member population enrolled across all of our different conditions, heart failure, COPD, and beyond, increase. Where we used to support a healthy mix of behavioral health populations, potentially patients with depression, patients with diabetes, hypertension, under self-insured employers, and then Medicare Advantage populations with COPD, CHF, and then post-discharge support. We've seen quite a heavy shift with more than 10,000 patients enrolled across a variety of programs toward the older end of that spectrum, average age of about 72 years old. I think just as an opinion, that's very encouraging because those are exactly the populations for whom long-term preventative support can make a big difference. That age is no longer really a barrier in care.
Great answer, great answer. And let's transition to the next slide before I jump to Guy. With a similar question of how was there anything that you saw that was immediately working or wasn't working as it relates to serving our patients and community from a technology standpoint?
Is that for me?
Yes, that's for you, Guy.
Oh, okay. Yeah, I have a slightly different perspective, but it affects our region and the whole U.S. basically. That I think telemedicine actually is a pretty mature industry, but one thing that wasn't mentioned in the previous conversation was the utilization rate before COVID was extremely low, meaning if you had a given panel of patients covered under insurance that had access to telemedicine, only 1 to 3% of those patients would ever use telemedicine over the year. So that's negligible. It's a big number if you have millions and millions of patients that have it accessible, but in the grand scheme of things, what COVID-19 has done, I think, is warp speed the education process around what is telemedicine on the doctor and patient side. And all the regulatory stuff that Blake and others mentioned is really helpful. But I think just from a consumer perspective, which is my perspective, so everyone else on the call can run circles around me around how this affects hospitals, reimbursement, all that stuff. But just from a raw consumer awareness perspective, I think we really sped up the process after years of incremental growth in telemedicine. From when you get sick, is it instinctual to call a doctor via telemedicine? Most people it wasn't. They went to the doctor. You go to the doctor. So I think everyone's trying it for the first time now, and I think once you've tried it once, we're really going to see what the true adoption rate of telemedicine is. Where it might have taken years before to really get to that level. I think after COVID, once we get back to the in-person experience, where the utilization rate settles out is probably the true rate that we've gotten to over the next 10 years, let's say. So I think it's a really interesting that we almost have this experiment in society where everyone's going to try telemedicine for the first time. And that's really going to increase adoption on the physician side as well as the patient side. So I know a lot of physicians that I was really surprised that they had never done telemedicine before, because just when you hear about it, you think everyone has access to it. Most doctors have had access to telemedicine. They could have been doing telemedicine for the last 5 to 10 years. So I think the awareness on both sides of the equation is really going to increase now, and we're going to really see what the true adoption of telemedicine is, which is super exciting and really interesting.
Lots of great nuggets of information there. I'm going to open it up to the other 3 of our panelists. Is there anything that you wanted to add about telemedicine and how it relates to maybe the volume and the speed of testing, what you've seen? Alan spoke to it a little earlier today, but as it relates to accessibility or appointments, or how do you monitor the health through telemedicine? Or I can call on you, Patti. You wanna jump in on that one?
Well, I would agree with the Guy that it's pretty amazing that telemedicine was so available and so underutilized. But, I have several examples. We have an allergist here in town, and it's a 3-physician practice, and they went to telemedicine from the very beginning, and they saw almost the same volume of patients by telemedicine as they did in clinic allergists. So I think that you know, things won't stay like that, but I do believe that there'll be more utilization of telemedicine, and the fact that reimbursement will pay for it now. I think that cat is out of the bag. Seema Verma may have used those words herself, who's the administrator of CMS. So I think it'll be hard for especially Medicare to go back on payments for telemedicine, and that would only drive increasing adoption.
Great answer. We had a question that just came in, and this one is for Guy and Blake. What do you see with adoption rates with seniors as a segment?
Guy, do you want to?
A definite uptake. I think seniors are just, in general, if you mention the word Medicare, their ears perk up. You know, I think it's so I think in the news, you see a major spike in, I mean, it was like in a different ozone layer of adoption in terms of Medicare patients, and on our platform as well. One thing that's pretty significant that I'm not sure is in the zeitgeist and everyone knows about is that they relaxed the in-person Medicare requirement for the first appointment. So before COVID, if you had an existing patient you had seen in person before, you could bill for telemedicine, remote monitoring, all that stuff. And so they relaxed that requirement, which really opens up a ton of opportunities for all the telemedicine companies to see a patient for the first time via telemedicine, and then they can bill for all that stuff. We're dabbling and experimenting in that, but it's not our bread and butter is concierge medicine, so it's a little different. But I know just industry wide, for that reason, and also just in general, the Medicare population has spiked incredibly in terms of telemedicine adoption. So it's actually not it's not that complicated.
So, can I take a picture of you?
Is everybody there?
Yep.
Okay.
Yes.
Guy, do you wanna add any thoughts to?
No, that was my my
I'm sorry,
take.
Blake, do you want to add any thoughts? Sorry, there was a weird noise in the background.
Sure. I think maybe a single statistic will help everybody understand exactly how accessible this has become. So again, just for our company, but I would bet this is seen across a lot of different tech companies. We're seeing a 90 to 92% activation rate for seniors with chronic conditions onto at least our telehealth. There's no way that's unique. I mean,
What was it before, Blake?
It's gone up over the past 5 years. I think starting off it was around 70%.
Okay.
But yeah, the sky's the limit.
Okay, so let's move on to talk about supporting our healthcare providers, because we had some questions around that. What safety measures are in place and what supplies as we look forward to the next phase, if you will, of COVID? What can we expect to see when we visit a hospital? And I'm going to start with Alan on this one, move to Patti, and Guy and Blake, I'm going to encourage you to jump in once we get to supplies.
It's vitally important that we help assure our patients and our employees and contractors that we have a safe environment. And safe environment, the definition for it has changed as a result of COVID. Everyone has a heightened sensitivity. So the availability of personal protective equipment and the expectation that we use it. So plexiglass around registration areas, individuals stationed at entryways to help assure that the symptoms that are evident for patients are identified. So for example, if a patient has an obvious cough or a fever in excess of 100.4, I believe is the range, then we would want to be more careful to assure that that individual is kept safe, others around that person, visitors, patients, and staff are kept safe. So these kinds of questions are relatively new for the health services environment. And so I would just suggest that as we adopt and adapt to this new idea, this new normal, that we're thinking about the safety of our patients and our staff through the use and the expectation of the use of personal protective equipment. One last addition there, only recently the CDC has said universally, and supported by the Joint Commission and other organizations, let's all wear a mask, no matter where you are. So that's an example of ways in which we can help that assure that we remain safe and others around us remain safe. And people like Patti and me and our senior clinicians and throughout our organizations have an obligation to assure that that occurs. So that's one answer to the question.
Patti, did you have anything that you would like to add?
Well, I just add that it really has evolved fairly quickly. When I look back on our very first patient who was tested positive, we weren't, as an organization, all wearing masks and eye protection, and that was problematic because you potentially had people exposed to positive patients without adequate protection. And one of the reasons why we didn't do that initially is because we were all afraid of running out of PPE. Thankfully, we have had increasing stores and supplies of PPE. So now the way we've evolved is that any employee who has any contact with patients at all has to wear a mask and eyewear, so that that they can protect themselves, but also that we maintain a workforce. Because as you might imagine, if we have a lot of employees who test positive, we're going to have a hard time taking care of our patients. So it's safety is it has to be number one for our workforce and also for our patients as well.
Well said, well said. All right, let's talk about new innovative tools, because we had a few questions that came in when we sent out registrations as it relates to, everybody wants to know what's the biggest, baddest thing coming down the pipeline. So I'm going to start with Blake on this one of how do you think COVID-19 will impact the rate of innovation or the focus on innovation with healthcare?
I think that COVID-19 and the regulatory and incentive changes accompanying it will really give providers permission and the resources they need to look at what's out there in the market and then move quickly to adopt that innovation. So I don't think there's a fundamental shift where suddenly new technologies that never existed or were never conceived of will suddenly spring to life. But I think it's going to be really positive. I mean, I think it's going to lead to a lot of wins for provider organizations and for patients. I think that there's a kind of a back office category of innovation as well. Everything from revenue cycle management to new types of risk-bearing relationships that will form. A provocative question for all of the hardcore health nerds attending is, if everything were 100% capitated, if we were under a completely value-based structure with no fee for service, would that be better or worse for, Alan, you, for Patti, for you, and then Guy, for you and me, because that's
where I stand.
So Guy, tell us, where do you stand?
Well, I think I totally agree with Blake that it's going to be an acceleration. I think if you're a physician and you've gone through this either as an employee or as your own, if you have your own practice, and like Patti said, you're down, or Alan, you're down to 40% of revenue or less, many times less in primary care. You want to kind of future-proof yourself for the next wave, or in general. Now you're aware that, oh, there's some real fragility here, that a disruption of a few months can just decimate this whole industry. And there's talks. We're all primary care, so of a lot of primary care offices going out of business, which is just like, that's the spearhead and that's the quarterback of healthcare. So I think a lot of folks, specifically in that vertical and in the other specialties as well, they're going to be like very, very keen on finding new and innovative ways to kind of future-proof themselves. And the capitated model is one way to do that, where it's less dependent on that fee-for-service visit. So I think that this has really demonstrated the value of those types of models. And I think within that, it opens up a lot of flexibility around how you can care for patients as well. If it's a flat rate, you can kind of use innovative tools. And I think one thing, just texting or chat, we've been doing it for years, but I think the adoption rate for that is going to go way up. In fact, if I point to one specific thing, it's a way more scalable way of communicating with the patient in many cases. You don't require a phone call, but you can interact asynchronously via chat or text. You just needed a financial model to make it work. Most doctors, if you text your doctor and they text you back, they don't get paid for that right now. So I think if there's a financial model that makes that work, it opens up a ton of efficiencies and allows the system to scale a lot more in a time like this, where if you read the articles, I don't know the exact numbers, but the hold times for the big telemedicine companies were 2 or 3 hours because it was mostly phone based. So I think we're going to see over the next few years, once things settle down now, it's going to be a rapid adoption of tools that help future-proof the doctor's office and make them more efficient. And I think the payment models will catch up to allow that to happen, where the system was pretty resistant before COVID. I think it'll be much less resistant.
I personally love the texting option, all for it. So I'm going to turn to Alan and Patti with that information that Guy and Blake shared. What are your thoughts?
I would say if there is a barrier in the future, it's, if you will, who might lose as a result of this launch. Think of it this way. For every action, there's a consequent reaction, and one of those reactions relates to special interests. Are there special interests out there whose strategies would be affected as a result of the launch of telehealth? Society is going to suggest that, this is okay. Doctors and nurses are going to adopt and adapt very, very quickly because they're going to recognize we can monitor people at home, and we can do that safely. Once society figures this out, then legislators start to act in a certain way, and they respond to what the professionals know, the doctors and the scientists and the others. So it's the people, the organizations that don't benefit, that will try to stand in the way of the launch of a tool that is absolutely safe and effective, and a wave of how primary care will look. I will tell you that Affinia Healthcare this year will begin thinking strategically a great deal differently as a result of our learnings in the last 9 or 10 weeks.
I love to hear that. And Patti, how about HSHS?
Well, I would agree with Guy. I think that people who have been resistant to capitation or value-based methods of reimbursement are going to start rethinking that. So I think people are going to get more innovative when they're looking at methods of financing for the healthcare system, because there hardly anybody can withstand a 40 to 50% drop in your revenue or your salary, and so having capitated payments on a monthly basis to take care of a population of people might be a little bit more palatable than it had before. So,
yeah,
great. That was a good question. Okay, so final question on as we're on this slide, and then we're gonna start to roll towards the end. Is Guy said an interesting, I think it was Guy, he said an interesting phrase of future-proof. How are we future-proofing the healthcare system for the future? And Alan, you spoke a little bit about the testing sites that Affinia does earlier in this webinar. Is there anything that you want to add on to that, or Patti or Guy or Blake, as it relates to testing for the future, or future-proofing the healthcare for the future as it relates to COVID?
Experts are telling us that we need to think about testing and surveillance and contact tracing for a longer period than just June or July. That's one of the unknowns. We simply don't know how long we need to pay particular attention to this virus that doesn't have a vaccine to counteract. So it's fluid. It's every week we're learning something new. It's every week we're doing something new. I do think testing, to your question, will extend into the future, but in what way? Looking for what and identifying what? We're learning every week.
Patti, Guy, or Blake, did you want to add anything to that? No, I see a little bit of head shakes. Okay, so let's go on to about what has changed and what will stay the same. So Alan, that was a great segue. Thank you. We had some questions. So the most popular question that we had was, what is the future of telemedicine? Which I think we alluded to a little bit earlier, but if anybody wants to elaborate on that. But in addition, it's kind of a compound question of how are we leveraging cloud and more specifically serverless to deliver solutions more quickly? Does that make sense? Don't everybody jump at once. I'm going to go to Guy. Guy.
Sure. Yeah, I can talk about the future of telemedicine. I mean, I think you're going to see, you know, in the consumer space at least, you see solutions that are very specific. So on one end of the spectrum, you have these sites where you can just basically fill out a form and have maybe a very, very short telemedicine phone call or just via the form in a text chat, get a prescription. Then you have like the typical urgent care visit. You have your primary care doctor who also does telemedicine, just in general. They see you in person and they do telemedicine. And then you have things like SteadyMD, which I believe were the only ones kind of in this category of your permanent dedicated doctor completely online. And then your acute and urgent care is done in person at different facilities. So I think you're going to see a lot of point solutions in every specialty that focus on the specific needs of the patient, whether it's, I want to talk to the doctor for the shortest amount of time to get this prescription, which if it's, you know, maybe they can figure out how to do that safely, but that's a huge industry now. And then on our end of the spectrum, you're able to create a relationship long-term with the doctor completely online with great technology and then a model that makes that work. So I think you're going to see basically everything that's offline, people are going to come up with point solutions that are online. And they have in the past, just not many have been super successful, in my opinion. I think you're going to see more consumer adoption because most of telemedicine has been via insurance companies and employers. That's how almost all the telemedicine companies have scaled so far. So I think you're going to see new companies emerge in the consumer space, that's pretty unique. And obviously it's juiced by a ton of venture capital pouring into the space right now as well. So you're going to see a lot more direct-to-consumer offerings that kind of have failed in the past. They're going to get resurrected now for every specialty and every type, definitely every type of primary care, from urgent care to concierge medicine to new models around pharma. It's just going to be it's already accelerating, and I think it'll continue to accelerate. So my prediction is you're going to see a lot more consumer offerings versus just employer insurance or you know, like a service for a hospital to do telemedicine. Whole new models that didn't exist before. So I think that's my biased take on where it's going.
How does that, and this one is to Alan and or Patti, how does that affect the relationship from the primary care perspective? If things are going more on a virtual basis, like how does that affect the relationship with the patient? Because we always talk about really good bedside care and bedside manner, and there's a lot of face-to-face.
I can answer that one too. We have thousands of patients that are doing this right now across the country. So it's better, in my opinion. If you're a primary care doctor in a fee-for-service environment, you have upwards of 3,000 patients. So you're seeing, and Alan, you can spot check me here, but you're seeing 20, 30 patients a day under that model. And you're spending 50% of your time billing insurance. So it's hard to develop a long-term dedicated relationship with a primary care doctor definitely in a preventative way, and just hey, I just want someone that I can interact with and chat with and have a long-term, deeper relationship with. It's hard. All the doctors want that. I think it's not the doctor's fault, but it's hard to do in the environment. And so I think online you can create that deeper level of a relationship, and via really cool technology around video calls as well as text chat and phone calls, and then all the tools that kind of are focused on that piece. And that's what we do at SteadyMD, so that's why I took it.
I love it. Alan or Patti or Blake, did any of you want to jump in?
I would add that there's a generational consideration. And generally speaking, people who are older, like Alan, who are getting information from the AARP in their postal mail, a different group of people and thinking and different experiences than individuals in their teens, 20s, and 30s. So adoption by generation might be something that we consider. So do I think this is immediate as a result of COVID? No, I think there's likely a transitional process where we are continuing the face-to-face, even though we might choose to, we will have the ability to do it electronically through telehealth means. There's always that consideration. But that said, I think I agree with these technological experts. I'm quite sure we're going to see a wide adoption, much wider adoption than pre-COVID as a result of the virus. There's no doubt about that.
Well said. Okay, so we're coming to the end of our time, and we always like to ask, what's the golden nugget? So what's one thing that you want to share with our listeners as a takeaway from this conversation? Blake, I'm going to start with you, and then I'm going to go to Alan, Patti, and then Guy.
I think everyone in healthcare should be focused on kind of the sleeper wave that's approaching, which is populations with ambulatory care sensitive conditions, essentially higher risk chronic conditions, could potentially be very hard hit during the second wave of COVID later this year. So it's on all of us to make investments, make preparations now so that we're ready to respond and accommodate that.
Very good. Alan, what is your golden nugget?
I would plagiarize from something my daughter Amanda said. We need to be open to different. And it's helpful for me to think about that because different is here, and technology is going to play a major role in how that different is implemented. And as society, again, back to society, as society accepts these changes and is willing to act accordingly in the United States.
Very good. Patti, same question.
Well, in a little bit broader sense, I would say, you know, as leaders in a time of crisis, technology is great, but we do have to remember that there's like these touchy-feely sorts of things that you have to portray. And I would say the biggest thing is to make sure that you are sharing your vulnerability. So none of us have all the answers here, and to think that you do is kind of crazy. And if your people who you work with know that you have vulnerabilities as well, then they feel more safe actually to share their fears and their hesitations. And then people do tend to trust you if you're more authentic. So, you know, we're not out of this by any stretch of the imagination. And I think we all have to be real about it. And then hopefully, you know, we'll all get through this together. And, you know, next summer we might go on vacation.
I hope so. Guy, what is your golden nugget?
I want that vacation. No, I agree with what everyone said. I think obviously this has been a really interesting and dramatic time for all of us, and let's use it as an opportunity, like I said earlier, prepare ourselves for the next wave and maybe the next thing after that, that none of us have thought of something that might happen. Maybe we should start preparing for the unknown and use this as an opportunity to kind of take that philosophical bent around just thinking about the future and around the edge cases more. I think that's an important learning from this time. It's kind of like the Black Swan, if anyone's read that. Let's prepare for more of these to happen, and then we'll be able to cope with it a lot better versus kind of a shock to the system. So that's kind of my final nugget.
Well, I thank you, appreciate that, and that we're going to need some more nuggets because some questions just came in that we want to make sure we get to quite quickly. So I'm going to turn it over to Bethany, who is collecting the questions to ask everyone.
Hi. Well, first, I just want to thank Jennifer. Jennifer, welcome to the St. Louis area. Love hearing about people moving to St. Louis. So Jennifer had a question. They have a prosthetic company here in St. Louis, and they wanted to know if any of you have seen any telemedicine work in that realm.
I have not.
Sorry, neither have I.
Not yet. But
sounds like an opportunity.
That's what I was thinking.
Someone.
Jennifer. Okay. And then the second question I have for you is, have you seen an increase in requests for mental health services through telemedicine? If so, how is it being addressed? And has that changed the doctor-patient relationship for the better or worse?
yes, CareSignal absolutely has. Most of our provider partners are leveraging sub-physician licenses to support that population. So I don't think it's had any impact on the doctor-patient relationship per se, but lots of new relationships, very productive, rewarding relationships between care managers, care coordinators, and similar are popping up.
Anyone else?
Historically, we've found telepsychiatry and teleradiology to be acceptable in healthcare, adopted and acceptable. In our organization, again, back to March the 16th, the discipline that's had the highest percentage of volume of activity has been mental and behavioral health. And our leaders are telling me that it's been highly successful to reach out to individuals who are having a difficult time with shelter in place, stay at home, and social distancing. So I'm very pleased to hear that, and think that it's a further endorsement for the telehealth side of mental and behavioral health.
And we don't provide behavioral health services here at St. Elizabeth's, but we do have chaplains, and we did see a need, especially for our colleagues, in terms of anxiety and fear. And so we set up a chaplain chat line for our colleagues, which many did avail themselves of that. In addition, what we did for patients, especially patients in isolation, is they had iPads in their rooms. And so the chaplains and the social workers communicated with them mostly through the iPads to kind of minimize exposure and also conserve PPE.
Interesting. Okay, and then we'll wrap up. I have one more and then we are done. How have you seen different departments in the hospital system cross-collaborate in order to get things done more quickly and efficiently? They went on to explain, but they noted, like, has there been more electronic communications versus like a physical paper trail, or any ways that
we've seen dozens of different approaches with our different clients. Mm-hmm. The most successful, I think, has been a very agile team of individuals responsible for making final decisions, and they have near complete authority to implement those decisions within the different service lines that would normally remain siloed. So it's appointing it's almost a borderline philosopher king model. It's appointing people that understand the implications of COVID-19 really clearly, that collect data rapidly, and that can assemble strike forces to implement new solutions. And it's never more than 12 people on those committees.
Interesting. Well, that's all the questions I have for you guys, Lynn. Tabitha, teeing it up to you.
Fantastic. Thank you again to our panelists, Patti, Alan, Blake, and Guy. Thank you to Bethany, Mary, and Brittany at the Chamber for executing this webinar. And this webinar, as well as any links, will be sent out after we conclude. Big thank you to our sponsors, technology partners, and Kitty Academy. If you have any questions or would like to visit our website to find out what events are coming down the pipeline, please go to stlouisregionalchamber.com or reach out to one of us. We'll be happy to answer any questions. Have a great day, everyone. Be well.
Bye, everyone. Stay healthy, everyone.
You.
Thanks.